Senator Murray.
Thank you very much, Mr. Chairman. As we all know, chronic diseases, we've been talking about heart disease, diabetes, are the leading cause of disability and death in America, and it's all too common, as the chairman talked about. We have about 1 in 10 people in Washington State, about 1 in 10 Americans suffer from diabetes. So we really do need evidence-based approaches to advance nutrition and to prevent and treat chronic diseases like diabetes. Dr. Califf, earlier this year, I got to hear directly from you at our Senate Appropriations hearing about your plans to stand up the new Human Foods Program, including a new Nutrition Center of Excellence. Can you or Mr. Jones talk about how FDA is utilizing research from NIH and other federal agencies to scale up what we know about preventing and treating chronic diseases like diabetes and to better inform our food policy?
Quick editorial point of view, and then Mr. Jones can give the details. This is the largest reorganization in our history, as far as we know. 8,000 people changed. It was widely embraced, maybe contrary to some statements I've heard about federal employees, widely embraced by the workforce at FDA to do this reorganization because people recognized they needed a focus on this and a better structure to do it. It involves the entire inspectorate, the entire Human Foods Program, and as many people requested, we brought in a leader, Mr. Jones, to head the whole thing up. So it's a very high priority. A quick comment on NIH, and it's very important that we not tell at FDA, NIH what to do. There is a lot of nutrition research at NIH, but it's spread across all the disease and body parts areas, as I call it. We very much need this sort of basic research on obesity per se as an element, and there's some tremendous research by particularly an investigator named Kevin Hall on ultra-processed foods, very important to us. But we're going to have a big meeting next month, or this month, I guess now, between FDA and NIH on the research agenda, so look forward to that.
Mr. Jones.
Thanks. And one of the reasons we established this as a nutrition center of excellence.
Press it again.
One of the reasons we established a nutrition center of excellence was because we realized that we were not going to have the kind of resources that ideally one would want. And so the center is going to work with other entities within the federal government, including NIH, but other entities in the federal government, in particular USDA, and as well as universities, to make sure that we are fully taking advantage of and collaborating around the research portfolio around nutrition across the country. We work very closely with NIH, and as Dr. Califf said, in 2 weeks we are co-hosting with them a research symposium that's going to be focusing on what does the research agenda for ultra-processed food need to look like.
Okay. I also want to ask you, while you're here, about the modernization of the Cosmetics Regulation Act that we passed. For a long time, harmful substances have made their way into makeup, lotion, hair care products, and many other products that people use every day, and the FDA had no power to take any action. So back in 2022, we passed my bipartisan Modernization of Cosmetics Regulation Act, known as MOCRA, which empowered FDA, finally, with the tools it needed to better ensure cosmetic products are safe. It was the biggest change to FDA's authority to cosmetics since 1938. Now, it's been 2 years since the enactment, and I wanted to hear from you on how implementation is going and how the FDA is working to improve the safety of personal care products. The law actually required FDA to issue good manufacturing practices for facilities that manufacture cosmetic products. Since it's been 2 years, the FDA has not put out any good manufacturing practices. So tell me where we are with this.
Sure. So first of all, I want to thank you. I worked on this in 2016. It took a long time to get the legislation, and it's much appreciated and much needed. There's been actually a good partnership with industry to make this happen, but we have stood up the registration of facilities and products. Some Americans may not believe this, but there was no record of what cosmetics were being put on the market before this. And we've now got a listing and also a complaint system that didn't exist when there are adverse events, they can be sent. So GMP is on the list to work on. And I know this is not a great time to talk to Congress about budgets, but the budget that was allocated to this was a small fraction of the estimates by everyone involved of what it would take to actually meet the requirements of Congress. So this is going to need to be looked at in terms of, if we want this to get done in a timely fashion, there actually is time and material of qualified experts to get the work done. We're doing everything we can to use internal resources, like we use the drug complaint system to register adverse events. It saved a lot of money compared to doing it de novo.
Well, I'm out of time, but I just want to let the committee know I'm going to be following up on this, making sure that FDA is very aggressive implementing the law that we passed 2 years ago.